In Africa, we have observed that delayed treatment is common. Families misinterpret symptoms as spiritual or cultural, reinforcing stigma and isolation, and delaying psychiatric care. Many psychiatrists recommend integrating cultural dimensions into treatment rather than opposing them outright. But it is extremely important to avoid drinking drugs you are unsure about because it could cause kidney damage over time and you can lose your kidney function permanently. Now, let's talk about some risk factors. Who is most at risk? The people with personal or family history of psychiatric illnesses, especially bipolar or manic disorders. Women in their first pregnancy. African authors have reported a high incidence among primiparers. People having also severe medical or obstetric complications. People exposed to psychosocial stress, especially when it is prolonged, such as isolation, domestic violence, neonatal death, or severe illness with a baby requiring intensive care. Some people could also be affected by sociocultural pressure. For instance, preference given to a male child, rejection of twins or albino infants in certain communities. Another important risk factor could also be people doing drugs, consuming alcohol or addictive substances. I'm not saying that if your partner presents this disease, it means that she was doing drugs. Let it be clear. Anyone can develop this disorder, but doing drugs enhances only the probability, the risk of developing the disorder. Nearly 50% of women with puerperal psychosis later develop bipolar 1 disorder, especially when there is a family history involved. This highlights the importance of preventive follow-up for future pregnancies. Now, let's talk about prevention and management. Primary and secondary prevention are important. Prenatal screening is needed to identify at-risk women. Psychological follow-up, social and family support are also important. Preventive support with mood stabilizer and other appropriate medication highly reduce recurrence risk by nearly 40%. Early intervention is key to preventing further episodes. We need an emergency management, meaning the patient will be hospitalized, ideally in a mother-baby unit, to avoid separation with the baby. But usually in our African context, it is unavailable. So family support is vital to avoid prolonged separation. The doctor would prescribe medicines which are compatible with breastfeeding whenever possible.